I'm Cleo Caldwell, and I'm a social psychologist by training, but my faculty appointment is in the School of Public Health. I'm a professor and chair of the Department of Health Behavior and Health Education. There we go, we got some HBA. And also, I'm affiliated with the Program for Research on Black Americans at the Institute for Social Research. I'm an adjunct faculty member in the Department of Psychology and the director of the Center for Research on Ethnicity, Culture, and Health at the School of Public Health. So I have many, many affiliations on this campus. I'll stop at those, otherwise we'll take up the whole day.
I know.
I'm going to follow Cleo's lead and say that my PhD is in public health, but my faculty appointment is in social work. Hi everybody, my name is Daphne Watkins, and I'm a professor in the School of Social Work. I also have an affiliation with the Department of Psychology here, as well as the Institute for Social Research, also the Program for Research on Black Americans. And more recently, as of January 1st, I am the director for the Vivian A. and James L. School of Social Work, Center for Health Equity Research and Training. So it's the only, no, it's a really long name. We just call it the Curtis Center.
But that's the first thing you have to learn as a director of a center,
Yeah.
how to say the name.
Say the full name, because the donors, we thank them for their money, and we always have to make sure we say the names.
Well, okay, before we get started, we congratulate you on that. Congratulations
Thank you.
on that. Okay, so the format of this discussion is a moderated discussion, so I'll be asking our panelists here questions. However, and I have prepared questions, however, if you would like to ask a question, please raise your hand. I don't mind stopping and allowing you guys to ask questions, because this session is for emerging researchers to ask questions. And as you see, we have a lot of knowledge at the front of the room, so please take advantage of that if you would like to.
And so one more thing I'll say, so I keep interrupting you.
I love
that
that.
Daphne and I are on these kinds of panels
A
all
lot. Together for some reason.
I don't know.
I'll take it. Anytime I get a chance to hang out with Cleo.
Right back at you. So I just want to say that we navigate these kinds of discussions well. So please feel free to ask the questions that are really on your mind, because that's what's going to make a difference.
Okay, so our first question is, which populations of color do you focus on in your research, and did you hesitate before making the decision to focus on them?
So I focus on African American populations, specifically right now focusing on African American fathers, non-resident fathers, and their sons specifically. But I've been around for a very long time, and I've been fortunate enough to work with a number of African American scholars specifically who've done work on the African American population over time. And the mental health area is a big one. The work that we do with James Jackson over at the Program for Research on Black Americans focus specifically on the mental health of the African American population, but then it expanded with the National National Survey of American Life, thank you. It incorporated Caribbean Black populations to talk about the diversity of mental health that exists in the Black population, because often people think of it as being homogeneous. So my entire career I focused on basically the Black population, but given the types of collaborations that I have, my area of specialization is adolescents. So I've also done work with ethnically diverse adolescents.
So did you hesitate before you made that? I'm just going to do your job. Did you hesitate before you made that decision to study?
No, I didn't hesitate at all. But I'm interested in getting to some of the other questions on this paper in terms of the idea of resistance, because that exists, and that's been existing this whole time. There's a pendulum that swings back and forth in terms of when this research is valued and when it's not valued, because that's a real world, and that gets reflected in publications, that gets reflected in grants that you submit. So there are a lot of ways that you can see silent resistance to this work, and sometimes very vocal resistance to this work. So that'll be the more interesting conversation about my hesitation. I had no hesitation whatsoever. This is the only work I've wanted to do, and I've been privileged to have a career that allowed me to do it.
So I study Black men and boys, and I have since the very beginning. So I defended my dissertation from Texas A&M University in 2006, and I did my work on Black college men back then, and I have studied Black men and boys since then, and feel very confident that it was a good choice. However, as a student, I jumped into this work because I was just really disappointed with the lack of research that had been done on young Black men's mental health. I mean, I would look through articles and talk to people, and I saw like an oversampling of Black women, young Black women, but not a lot with young Black men. And so I think starting out in this work, I was really excited and I didn't hesitate. And then when I got those first couple of rejection letters back from scientific journals that said, where is your white comparison sample? I started to question, was I making the right decision? I really did. And so what's funny is I'm the kind of person that the more rejection letters I get, the more fired up I am about it. So you can thank my mom and dad for that. But for me, it was about, oh, they don't understand the value of this, so it's my responsibility to communicate the value of this work. And so I think starting out, I was excited about the work. The rejection letters and the lack of support from some of my mentors gave me some pause, but I realized if they have an issue with this, this is probably the right thing for me to be studying. I just may have to not have a linear path to success. I might have a more sort of curvy and creative path to success.
And I think that leads into our second question of whether or not you recall currently or in the past receiving any pushback from advisors or colleagues about the populations you focus on in your work, and if so, how did you navigate that?
Okay, I'll let Daphne talk about advisors. I've been doing this so long I can't even remember that far. But there's definitely pushback in the professional world about doing this kind of work, doing it on an African-American population. The first thing people will tell you is you must have a control group. But the thing that they will say is, we need you to have a white control group so we can understand your findings. Makes no sense whatsoever. Because there's diversity within all ethnic groups. And you don't have to always compare it to white. But there is a pendulum that swings back and forth that people will make this argument sometimes, and it comes out of left field for people who haven't been exposed to it before. I've been fortunate to have worked with some of the greats in the field who had battles, who fought these battles to make sure that you can have work on a single identity ethnic group and be able to show the variations that occur in those groups, that we are not a homogeneous group. When we were doing the work on African American and Caribbean Black adolescents, we sent the manuscripts in for publication. We'd get editors to say, why would you expect there to be any differences in these groups? We did have a population of all second generation youth. So youth were born in this country. So in their minds, if they're born in this country and they're Black, what are you trying to distinguish between? Not recognizing the importance of culture, not recognize the importance of socialization, that their parents were still transmitting these values and expectations to them, and that for us to understand anything, particularly about mental health, we've got to understand something about their social context, their historical context. All of this matters. It took us a while, but we've been able to break that barrier down. But some of the first comments we got were, why would there be any difference between, they didn't read the paper because they would have found out there was a difference if they read the paper. Same thing in submitting grants to NIH. They will say, well, don't we know this information already? And I say, you tell me, because I don't know it. I haven't seen it published. But they will say, well, if we understand it for white youth, then we understand it for Black youth. And I said, oh my goodness, that's so short-sighted. But these are battles that had to be fought, and you have to have people around you who are champions for you because they know the uphill battle. I don't know if you've recently seen a publication out of NIH that talks about 1% of African Americans get NIH grants, and that was done in 2011. The 2019 follow-up study now tells us that one of the reasons why it's so difficult, and they said Blacks specifically to get funded at NIH, is because of the type of topics. The type of topics. So you're interested in social justice, you're interested in health disparities, you're interested in health equity. These are the topics that they're saying are not getting funded in the same way as other topics. And the other thing that comes out of that is sometimes a white person is more likely to get funded on your topic than you are. So all of these things are part of the uphill battle out there, but they shouldn't be discouraging because you know that there are others fighting the same battle, and that when you break through, you will have an impact.
So I'll jump in and say that I don't think I had a lot of advisors who pushed back per se. I think I had a great group of advisors when I was a doctoral student who said, just know it's going to be a tough battle. Like, I think they just sort of warned me. So I was trained in the health education department, that's what my PhD is in, and I found that most of my classmates when I was going through the program focused on a disease. Like, we're gonna focus on cancer, diabetes, so on and so forth, whereas I focused on Black men's mental health. And so they sort of didn't know what to do with me, because I wasn't focusing on sort of a chronic physical health disease. There was no one else who was studying mental health in my department. And so I think they just warned me and told me it was going to be really, really difficult, and I think I realized that. But what I ended up doing was I found some great mentors outside of my university. And I know what I'm saying here, not my department, my university. Because I realized that even within my university, there were limitations to how people viewed and valued the mental health of people of color. And so I had some mentors who connected me to folks outside of my university in Texas, which made a huge difference. One of the reasons why I came to Michigan as a postdoc in 2006 was because of people like Cleo, who, were a part of that group of people who were paving the way so that those of us who are coming behind them don't have to fight this battle to justify why we want to focus on one group. I too study within groups of Black men, mainly because I do intervention work. And I think it's really important if you're going to tailor and target interventions for certain groups of people to be very specific about within differences. And so for me, this was a battle that, I was willing to fight, but thankfully I had, champions ahead of me who sort of cleared off the pathway so mine would be so long.
Thank you. And this question was scheduled for later, but you guys have brought it up a few times, so I'm going to go ahead and ask it, especially because it's also something that I've experienced during my doctoral program. How do you feel about the use of comparison groups in studies on people of color? I mean, and if you had the opportunity to visit my post, I focus on Black women, so I've already received the okay, so are you going to compare it to, all women and then look at difference? I'm like, no, just Black women. So how do you feel about the use of comparison groups, and what are some ways that you've learned to kind of push back against these suggestions to have some type, constantly compare people of color to another group?
This is my favorite question.
Yeah, I was going to say, Cleo, I'm going to just take a break. Cleo's favorite question. I'll be back in 10 minutes.
So one of the issues, even from a scientific perspective, is that's a fallacy. You're not comparing the same thing. Most of the time you're comparing apples and oranges. I'm a developmentalist, and some of the human development work that I did, we would always look at African American families compared to white families. And it was middle-class white families compared to low-income African American families. What's the comparison? Who needs to spend money on that? That's not where we need to go with this kind of work. I've done work with students who were able to demonstrate that from neighborhood, for example, socioeconomic status within neighborhoods, depending on the populations within that neighborhood, the bars don't even match in terms of the comparison. So what are you comparing? So having an appropriate comparison group or control group is very important. Otherwise, you're going to find differences, but why shouldn't you find differences? So it really has to be very thoughtful. There are conditions under which it's important to have a comparison group, but we really need to approach it in a much more thoughtful manner than simply saying, for health disparities work, you must compare Black and whites.
Yeah, and the only piece, ditto all of that. The only piece I would add is just, I really think there is something we need to explore about the psychology behind comparing to white groups. Like, what about white groups has become the gold standard? And I think there's so much danger in that. So I ditto everything Cleo said. I just want to push on and just try to encourage you all to think about what's the psychology behind what we decide is the comparison group.
So I teach a course on social determinants of health. Come right back to you. And one of the things I say, because this is a class, last year was 264 students in there, so we had a whole lot of varied backgrounds in there. So my question to some of them was, tell me something about what's different within white populations. Because people say white as if that's a homogeneous population as well. There are lots of differences in there. There are some vulnerable groups within that population. But with all we talk about, white as the collective being the better marker for comparison purposes, we don't even learn about that population. And let's not talk about Arab Americans who get classified as whites, so we know nothing about them. So when people are talking about these comparisons, they really need to take a step back to be very thoughtful about what's going on.
I am so great, this is why I came. I really think a lot of the innovations in academy Black work gets pigeonholed into a sort of ethnic theorizing. It's not seen as a critical methodological way to think about what the scientific method is. And so I understand my work as the unscientific method. You're asking me to adopt a scientific method that reinforces I am not a human subject, and I can't actually do my work that way. And so to Shanice's research, but to this point about the professional issues, like we don't get to see the NIH, like grant reader, like we will never interface with them, you know, we get their feedback as it relates to like people who read your proposals and they circulate the information and give you feedback in sociology before you get approved for a grant or before you get approved for a scholarship or an R&R, these kind of things. For me, as a first gen like Black woman in the academy, it's like, how do I find a method that is informed by a theory that assumes I am a human first, and then develop a method that assumes the knowledge that all my human capabilities are functioning just fine, like that my thoughts are not dysfunctional.
That you're not starting with deficit knowledge.
Exactly.
Yeah.
So then on top of that's the sort of professional reading of what is the asset of knowing Blackness in general? Like that's the other question being asked, as though the answer is nothing. As though like there's no reason to ask Black people for the knowledge anyway, because what use will it have in the academy? So my question to that is, in what ways do you feel like that Black methodology or like methodology that sees Blackness as human in research does play out or is useful in the university space or in interaction?
So my argument, I think that's an excellent question, and we also have to position ourselves based on our lived experiences. So we get all these kinds of negative reactions to what it is that what we do. One of the things that I would suggest not doing is classifying anything as Black methodology. It's methodology. And methodology is going to vary depending on population. And there are going to be some things that are going to be more relevant to some populations than others, but it's our job as researchers to be able to articulate what we're talking about, and social context matters. So we may take a different approach for some things. I'll give you an example. In the National Survey of Black Americans that James Jackson did way back in the late 70s, early 80s, had this question. It was standard ISR protocol. A lot of times when we develop questionnaires, we just say ISR protocol, and we know how we go about developing this question. The question was, how satisfied are you with your job? What do you think the result was? About 95% of the respondents said they were very satisfied with their jobs. Now you just know, just in distributions, that's not likely. Something else is going on here. Everybody's not satisfied with their job. But I gave the context of the time frame because a recession was going on at the time. And when they did back translation sessions with African American populations to try to understand that question, they found that people were just glad to have a job. So they're not responding to what you think you wrote as a researcher. They're responding based on their lived experiences. So they revised that question, and there's one that we continue to use to this day. How happy would you be, how satisfied would you be if a son or daughter, same gender, had your job? Variation all over the place. All over the place. So you've got to spend some time understanding your population and putting it within the context of their lived experiences. If you don't know their lived experiences, you need to engage with communities that do, work with colleagues that do, and come to better ways of understanding, but more importantly, interpreting questions. I don't know, what question were we answering?
No, we were answering all these questions.
Asset framing
Yeah.
methods and not actually classifying in order to do it. So
Right.
thank you.
Well,
Right.
yeah, the other piece that I would add is be careful about othering yourself and othering your own work. You know, like we get really upset when people other us as a population or as a sample, but sometimes we find ourselves doing it to try to be sort of unique or stand out, and sometimes it can further marginalize the work you're trying to do, right? I mean, people are just biased, you know, so I don't want someone to not read your work because it says Black methodology, for example.
Yeah.
I want them to see it as methodology, and then they learn something new because they're like, oh wow, this is unique to Black culture.
Yeah.
And one of the things, especially as students in training, postdoc, different kinds of positions that you have, this unconscious bias creeps in because you're being socialized and trained by the academy. And the academy has very strong influences in terms of what we do. Oftentimes we don't ask the creative question because we just want to replicate what's out there because we don't believe anybody will buy. the different way we want to ask that question. So unconsciously, a lot of times, we are adopting those same kinds of behaviors instead of saying, what is it that I really want to do and why? Where's that passion coming from about the work that you're doing, and what difference do you think it might make in people's lives?
Thank you. And another question?
So I'm finding myself doing my first research experiment, well, at least trying to get it funded. And I find that because my topic of choice is intersectional and also controversial, it's been really hard to get someone to even sit with me and talk about it, or they do and they don't follow up. And so I'm just curious as to how to navigate such challenges when it comes to getting funding for your research experiment.
So you're talking about a topic that's not an easy topic to fund,
Yes.
and even when you reach out to people to try to get feedback, they don't follow up with you.
Yeah, they was like, oh, that's nice and all. They didn't follow up. Even the research office in my particular program, I reached out to them at least 3 times now. And I even called by phone, and the response was, well, I'm sorry, it's been so busy here, and it's been over a month. And then when I go to other entities, I don't think that we're knowledgeable about how we have a lot of classism and respectability politics at play, even amongst, groups of color, or black women, if you will, because the response I get was, well, don't nobody respect them, so why would you want to research them? And then having to perform emotional labor to educate them, like, this is why, So it makes me very hesitant to even, I want to do my research, but it makes me hesitant to even go pursue it and engage with other people who are not already doing the work. And that's another challenge, is that I didn't see anyone here that has research that aligns with mine.
Okay, you definitely packed a lot into
Sorry.
that question, but I can also hear your passion about the experience itself. And are you talking about funding from within your institution, or funding from foundations, funding from
Not
federal
foundations, I
government?
would say from the institution, like whether it's inside my particular institution as well as cross campus, it's just been challenging.
Okay, so one of the things that we know we have to do is we have to be persistent. Squeaky wheel gets the oil. So that phraseology is absolutely accurate, because people expect you to give up. So when you ask and they don't respond, they just assume you're not going to come back again. But that persistence matters, and doing it in multiple ways. One of the things that I find with young people nowadays is because many have been born in generations where they have never lived without technology, the internet, all of that. I'll have students sit outside my door, and they'll send me an email or a text and not come into my office. That doesn't work with me. That personal touch matters. So when you're reaching out to people, guess what? Sending somebody an email is the fastest way for somebody to say no. If you don't want to do something, just send me an email. Hurry. But when somebody reaches out to you, whether it's by a telephone call or a letter or in-person meeting, setting up an in-person meeting, you need to be clear about what your ask is. Because if you go to people and you're confused about what you really want, then it's also easy for them to dismiss you. But setting up a meeting, sitting down, having that discussion with them, and before walking out of there, have your list of, now what should our next steps be? Get that commitment before you leave that office. And then at least they'll have to, it's their job to help you. So that's what you have to understand. You're not bothering, you shouldn't be bothering them. Some of them may act like that. But it is their job to do it. So I encourage you to be persistent. And I also encourage you to find, again, those champions that we were talking about. Because sometimes somebody else may need to reach out to find out why you haven't heard from somebody.
Okay.
I was gonna say the same thing. I was gonna say, I don't know about others in the room, but I was a first-gen college student, and I didn't know what I didn't know. I didn't know how to navigate an academic, predominantly white academic space. And so my advice would be just find people who can help you figure out, like, okay, if you can't go through this door, what window can you crawl through, so to speak, right, to get to the people you need to get to. So you may want to think about talking with people who can help, wink, wink, talking with people who can help, wink, wink.
Okay. I'm not over here, but I'm like, you don't talk about crawling through a window, no. You talk to a hood girl. I'm like, just saying.
Talking with people who can help you get in the room. That's what I'm saying. Because I I remember being at your stage, and I remember not knowing, oh, if I just went this route instead of this route, somebody would answer my phone call. If I just stood at the door and, you know what I mean? So I think that don't go through what seems like the traditional route. Talk to people who may have other ideas
All right,
to
thank
get your
you.
questions answered.
The other thing that within universities now, I think around this country, everybody is into diversity, equity, and inclusion. So when I was coming along, back then, the term was if somebody said racism, the whole institution would crumble because they couldn't deal with the thought that I was at the University of Michigan. Anybody could say anything about Michigan that was racist. So now, under the new terminology around diversity, equity, and inclusion, a lot of people have to respond, particularly on research with diverse populations, because that's actually going to be the backbone of that institution. So being able to work with people in those kinds of positions to help you navigate is very important.
Okay. So we're going to switch gears just a little bit, and this is also something that I remember talking about in the first year of my program. How do you feel about the claims of a lack of objectivity among people of color who study their own group?
Another one of my favorite questions. Now, I do remember back when I was in graduate school, I was taking a research methods course right here at the University of Michigan in the Department of Psychology. I'm gonna be open about it. It was a small class. Professor was fabulous. I have a good relationship with him even to this day. But we were having this discussion. Now, I'm the only African American in the room. And they were all excited because they were going to be bringing somebody over from ISR to talk about the program for research on Black Americans. And as we are in a research methods class now, we are talking about this. And he said, now one of the things that ISR's board had to do when they were first bringing the National Survey of, what is it, NSBA, National Survey of Black Americans, thank you, into the Institute for Social Research, the executive board of ISR had a discussion, because they were also bringing the Chicano study in at the same time, about whether or not these two PIs, one African American, one Chicano, would be able to objectively do the research that they had been funded to do. And he was using that as a teaching point in the class. So I'm sitting there very baffled because I'm, been working with NSBA. And so my question to him, because there were a whole lot of questions that people asked, and they were really excited because ISR is very prestigious on this campus. My question was, did they have an executive meeting about white folks doing research on white folks?
That's what I was thinking. That's all of the
A
research.
natural question. And he looked at me stunned. We've never considered that. So these are some of the assaults that we experience. But one of the things I have learned, because again, I've worked with James Jackson for a very long time, is you understand where people are coming from, and then you give them the counter argument as to why your work is important. You've got to give them information that's going to allow you to be able to do exactly what you want to do, but they have to hear it first. So you have to start from someplace reasonable. In order for him to do that study, he made an argument about methodology again, the sampling process, and how when we do research with large national samples, the percentage of African Americans that are going to come into the sample are the percentages that they represent in society, right? So this large national study, you've got thousands of people, but you got, what, 10%, 12% African American, guess what? When the work is done, they said we can't analyze by race because we don't have a large enough sample size. So he turned that around on them to tell them we need to do a national survey of just blacks. Because right now, you don't have a representative sample of blacks, you don't understand them, what you have is blacks in proximity to whites. So being able to make those kinds of cogent arguments, people begin to hear you. But attacking on a regular, not black, but a regular methodological area that you're never going to get a large enough sample size to be able to learn anything about. And this was Jerry Guerin's Americans View Their Mental Health, was the precursor to that. He had 120 blacks on this big national study. And I think that's what opened some of his colleagues' eyes about we really can't do any analysis with a sample size this small.
Okay, so I'm trying not to say what Cleo's, I'm trying to repeat the same thing, I'm trying to enhance it and add to it. So two things. First of all, the first thought that came to my mind was, I would want people from a certain group to study those people. Like, that's just me. Like, I feel like I want black women studying black women, because I'm a black woman. I feel like that's just personal. Although on the sort of research side, so first of all, full disclosure, I'm a mixed methods researcher. So I'm battling with this idea of objectivity being the gold standard for a lot of the work that we do. So my qualitative training would tell me that while I understand the value of being objective in research, there's also some value to being reflexive about the work that we do, to being able to have stories that are being told, and to be able to see ourselves in these stories. And so for me, I think this kind of highlights what Cleo was saying too about small sample sizes. If we continue to put value in numbers and not voices behind the numbers, and I think we're doing the work all wrong from the very beginning. And so I think if we continue to value objectivity over transferability, which by the way is the corresponding qualitative term to the objectivity of quantitative research, I think we're missing the boat. Because one of the things that my work would tell me as a mixed methods researcher is that qualitative and quantitative research, right, or stories, complement numbers, right? And so I think for me, yeah, I'm trying to wrap my head around under what conditions would I only want to be objective under my work, and I don't think there are many. I feel like I would need some context for the stories that I'm trying to tell. And this is methodology. This is not Daphne methodology or black methodology. This is methodology. Thank you.
No, I think that's really a good point, because the truth of the matter is nobody's truly objective.
No, we never are.
No
Never.
matter how hard you try to be.
Even statisticians, for those of you who if you think you're being objective, you're not. We all come to research
One of
with
my
our
favorite
biases.
books, How to Lie with Statistics.
Yeah.
What
You
is
can
it?
come, how to lie
With
with
statistics.
statistics.
Yeah.
You can come up with the conclusions
Yeah.
before you even do the work.
Yeah, and I don't want to get in a soapbox because I know we have other questions, but I do worry a little bit about us attaching value and rigor to just quantitative research. And I'm happy to have a sidebar with people about the rigor of qualitative research. I was an anthropology major, by the way. So I do want to attach some rigor. At some point we can have a conversation maybe after this about the corresponding terms we use to demonstrate rigor on the qualitative side.
Okay. So in thinking about what you currently study, I would like to know what has been the biggest obstacle in your chosen area of research that you've had to overcome in your career, and which resources were most helpful to you?
Interesting. As I said earlier, I'm currently studying non-resident African American fathers. When I say that, what conjures up in your mind?
Absentee father.
Thank you. When I did this work, initially every presentation I went to, people would say to me, oh, you mean you're talking about absent fathers? How could I possibly be talking about absent fathers when I'm talking about fathers who want to engage with their children? But because of the stereotypes that are out there, people automatically assume, you say African American fathers, they say deadbeat dads. And this translates into reviewers for proposals, for journal articles, for whatever. So we have an uphill battle really trying to communicate that there's diversity among fatherhood and in the fatherhood literature. And most of the literature that focuses on African American family takes the male out of the household. So you never look at anything that has to do with the male except what he's not doing and all the deficit models that they use. But one of the things that struck me when I first started working in public health, and I love my position in public health, we were asked, because we were putting this work in as a demonstration project for the Prevention Research Center that CDC had a call for. And there was a lot of competition, like Daphne said, all the cardiovascular disease, all the diabetes, all of the traditional chronic illnesses that people do very important work on, no question about it. So what we proposed was, let's look at this family-based model to really understand something about African American male youth. And we were interested in working in the city of Flint, and they were at terrible risk there, experiencing lots of traumas within Flint. And rather than looking at the traditional model of putting up mentorship programs for these youth, we said we want to strengthen those bonds between the non-resident father, specifically, and his child. And we think that would give us some leverage in terms of continuing support for the child. In doing this work, we've also found that it's been beneficial to the father's health, mental health, as well as substance use behaviors in the kind of work that we did. But the question that we got when we were presenting this idea initially was, what does family have to do with health? What does family have to do with health? Now we're all into the social determinants of health, and we understand the social networks and family relationships are a critical part of that. But at that time, people didn't think because, well, are you going to check his heart? You know, what are you going to do with them? But the bottom line was that these emotional relationships became extremely important, and the fact that people thought that African American fathers specifically had nothing to offer his children was the uphill battle that we actually had to face. And we've been challenged by it, and we figured, okay, our best revenge is number one, get funding. You like NIH? We can get NIH funding. You like CDC? We can get CDC funding. You like foundations? We can get Ford and Annie Casey Foundation. We've been funded now doing this research for 20 years. So it makes a difference. We don't have all the funding we'd like. Lots of rejections along the way, but that persistence is there so that we can actually communicate something in the literature about the significance and importance of this particular way of looking at health specifically.
I think for me, the biggest obstacle is actually two. And I think one of them is funding, but the second one, I think, is trying to demonstrate how multifaceted Black men are. I feel like that has been so difficult to communicate. I think when you talk to people about gender, that's a reference group. It's not an actual focus of a research topic. And I know one of the things I probably have on every presentation I've done for the last 10 years is a double-sided arrow. And the middle part of the arrow says masculinities, to demonstrate that it's plural and that it's fluid and that any man, any female, anybody can be on that sort of arrow at any point in their life, and it evolves, it changes over time. And I think that has been something that's been very difficult to demonstrate because, again, most people tend to focus on race and sex, which are very important, but the elephant in the room when you're dealing with any kind of gendered group is a lot of times the gender of the group that sometimes doesn't get parsed out as much. The way that I've dealt with that challenge, which I think is your second question, is I've actually opened myself up to receiving and studying the literature of other disciplines. So not limiting myself to just social work or public health, reading education, reading psychology. One of the things that I always tell my doctoral students, I always tell my postdocs, is that this goes back to sort of my training, thinking about how I wanted to be the expert in Black men's mental health, period. Not the expert in public health, not the expert in social work, not the expert in education, period. And I think if you really want to command a literature, you have to read everything about that topic, whether it's in your discipline or not. And I really think that was the best advice I ever received as a young person, was not saying, oh, I'm in public health, I'm going to know public health. No, if I want to solve problems, right? Not just get published, not just get a job. If I want to solve problems, I need to know what everybody's doing on my topic, right? And I think that's something that was very, very important to me. But the biggest obstacle, again, the first one anyway, was being able to demonstrate masculinities and quotients. The second one is funding, because I haven't yet been as successful as Cleo as getting some National Institutes of Health funding. But I think one of the things I've learned as I've sort of made my way through the different ranks of my career is, getting the funding that you need to do the work that you want to do. And I think sometimes when you're being trained at institutions like the University of Michigan, you're told that if you can't lend $1 million, then you're not doing a great job. And one of the things I had to learn very early is that if NIH doesn't like my work, somebody will. And that's actually what happened. Robert Wood Johnson liked my work. Kellogg Foundation liked my work. Other foundations liked my work. And I think sometimes the way we communicate that to the up and coming can be a little bit skewed, because we tell you, as I was trained actually in public health, if you don't get this kind of funding, then you are not a successful scholar. And I just got promoted to full professor, and I was able to get the funding that I needed to do the work that I wanted to do. But again, I mean, lots of imposter syndrome. Oh, you all. But lots of imposter syndrome along the way, because for me that was a huge obstacle that I thought would completely derail my career if I couldn't do what other people told me I needed to do.
So in the last minute or two of this program, I do want to open it up to the audience, ask any final questions that may be on your mind. Yes.
So one of the things I deal with is I'm so curious that I have many interests. And if you're saying you have to know your stuff, you know, you can't know everything. So how do you decide how to hone into that thing, or how do you choose that thing? Because I got a lot of things that I'm just deeply passionate about. I mean, equally deeply passionate about those things.
So are you talking about topic or discipline? So are there different
I'm
topics
talking about like what you're
interested in?
saying. You need to know your area, the area that. How do I choose what I want to be an expert in? Like right now, my research, my if I was to overall do it. Sorry, I'm trying to rush. If I was to do it overall, I would say well-being in African American women. But that is really broad. I'm interested in yoga. I'm interested in positive messages and like well-being as a like reinforcing, not the kind of like the positive psychology approach in social work, where you're not really looking at all the ways people are sick, but all the factors that is contributing to their well-being, the positive things. So that's kind of how I sum it up. But even looking at this, like I'm looking at this sense of community right now, you know, I think that's an important part of well-being, but I'm in a whole new level of data right now, stuff I've never read before. And I feel like I'm going in a whole different area. So how
do you
need to
focus,
know.
essentially?
Yeah, how do I narrow this down? And now my curiosity is peaking with sense of community, and I'm like, oh, I want to go all the way. So I think it's part of my personality, but I do want to be that girl. I want to be the person that people call, and I want my focus unique enough that I am that person that people call for that unique focus. So how do you do that? How do you narrow this down?
So this is really a very good, oh, you have an answer?
I do have her.
Oh,
Wait. No, because this is, and I wanted to double dutch jump in on that beat and say like, thank you for saying that as a professor, like in this moment in method, because they come in niche, and I didn't know, like that was one of the things I didn't know about standing in the door, like come in niche, know your little projects, slice off pieces of cheese and just get, you know, just nibble on this small piece of what intellect and knowledge is. And I went to a liberal arts undergrad where they didn't play that. Like you're gonna be in math, you're gonna be in social science, life science, soft science, hard science requirements. So I like was in an undergrad setting that did do that. That said interdisciplinary, as it were, was quite literally knowing multiple disciplines, how they talk about a topic. So from qualitative work, actually, saturation is how you'll know. So I haven't written a thing in my program for 2 years, but I was waiting on this sense, like the sense that I had something to say and trusting my body. Like I'm not just gonna write no bullshit. Like I'm not gonna write something I don't believe in. It's just not gonna happen. And saturation was this concept from qualitative methods of like, as you're interviewing people and you're sort of doing ethnography, there's going to be a point at which everyone in your sample is saying something or getting at that same thing, and trusting yourself, like doing this auto-ethnography of your learning process. Like there's going to be a point at which you hit saturation for yourself. Like you're gonna get all that stuff, I don't know, like organized for you, if it's Post-its or if it's poster boards or if it's OneNote, Microsoft, or Google Drive, or however you have it. It's like you're gonna hit saturation, and believing that that moment will come for you is like what should keep you going. So like eat and read everything until you reach that moment where you're like, oh snap, like I got a burp. This is what I wanted. Like this is what I wanted to say. You know, like a good one. And if like I'm hitting mine by being at events, like do it all, like watch everything. Housewives, Spaghetti Shop, Yangla, like whatever media. It's like believing in that saturation. Like you will hit saturation, and having people believe in you that you should read like that. Like, that is so rich and a rich learning tool that I'm glad I waited. I'm glad I waited to burp, as it were.
We have a new way of visualizing.
Well,
Oh, no, are you sure?
no, go
Are you
ahead.
asking a question?
Yeah, I was asking a question.
Oh,
yeah.
Did you guys want to answer
So
the
just
question
really
first?
quickly, I can tell you what worked for me. So as a graduate student in public health, I remember writing papers on infant mortality and cancer and diabetes and prostate cancer. And then I got this bug. It was like I was bitten by this Black man's mental health bug. What did it for me? I found myself reading about Black men's mental health for not a class, not an assignment. I was reading because I wanted to know, because I have a Black father and a Black brother. For me, what changed the game was anything I was reading because I genuinely wanted to know. I realized that was what I should be studying. So it wasn't to impress a colleague or impress a classmate. It was, man, I just want to know this. Even if I've never used it, I just want to know. That's what it did for me.
So I start with, people usually say to me, what are you? Because I'm a psychologist, I work with social workers, I work with nurses, I work in public health, I work in mental health, I work in a lot of different areas because I've had a lot of collaborations as well. And so reading in different fields and different disciplines becomes a part of that. I always smile with public health because they love the socio-ecological model, right? They don't know sometimes that that's from developmental psychology. So and then engineering, stress theory, it's from engineering. So there are a lot of different disciplines that you can bring into your work to really enhance the richness of what it is that you're doing. So, but for me, what helped me focus on what I was interested in happened way back when I was in graduate school for my master's degree. And I was in this contemporary families class. And in this class, we were reading about all of these different families and different things. The last chapter in the book was on the African-American family. And that chapter came from such a deficit model. I looked at it and said, I don't recognize a soul I know in this chapter. So I asked a professor about it, and she said, well, unfortunately, this is all the research we have at this time. So if you want to make a difference, you need to do research. So that's how I got introduced to the whole idea of doing research, and then narrowing it down. I would read all of those negative things and say, I don't want to say that. I frame my questions even to this day from a positive perspective. But I was driven by just looking at what's out there in the literature and trying to figure out where would my niche be. And for me, that helped to narrow down some of the focus. There's tons of things out there. But sometimes those external deadlines begin to help you make decisions. You can't do everything. And you have to take that first step. Otherwise, you'll be paralyzed and never get anything done. But just figuring out how do you prioritize what you want to say first.
Final question?
Yeah, quick question here. Maybe not a question. So my background is kind of in HIV, specifically in like racial health disparities. And I feel like we're kind of acknowledging that systemic racism often is what's driving racial disparities in health. Yeah, I feel like sometimes we do research on Black communities. And there's this tendency maybe by non-Black communities to like then pathologize Black communities and act like they're unique, which I think in some ways kind of like obscures what is the problem of systemic racism. So do you ever feel like research on Black communities kind of either is pathologizing people outside, or like that we kind of fall into the habit of like pathologizing our own communities, and then that kind of distracts from the larger systemic problems?
Quick answer, yes. But a little bit deeper in that, one of the most important pieces of a manuscript to me is the implications. What are those implications of your work? And people can have exactly the same results and very different interpretations. So I agree with you 100% that sometimes people just pathologize because that's what they're used to seeing, rather than saying what's new and unique and what can move people forward in a positive kind of way. We have to be able to be mindful of ourselves doing it, because it's so easy to fall into those kinds of traps. But if you're aware of it, which you are, and we know from a serious change perspective, we have to deal with structural changes. So it's not just individual behavior. And when we are focusing across those multiple levels of that socio-ecological model, that allows us to be able to look at those structural influences. Policy. Sometimes we think, oh, this is a wonderful policy. Policies are differentially applied, and people lose as a result of that. So whenever you're doing your work, you want to understand who's going to benefit from what I'm doing and who's not going to benefit from what I'm doing. That becomes an important part of determining how carefully you assess what your findings mean. Because anybody can take your findings and run with it.
Yeah, that's right. That's right. Just acknowledge your power in crafting the story around whatever you find. Like, I think it took me a while to realize, even though the data says this, I can speak about it in a different way. I always say simple statistics, sexy story.
Ooh, I like that. Okay, well, I hope everyone in attendance today was able to learn something. Please join me in thanking our panelists for